So, health and security. Health is very often seen as a global security issue. And the way in which governments treat it when they start to call it a security issue is with a military style stance. So a good example of this is H5N1, avian flu. Governments put out warnings, they stockpile vaccines, and they improve their surveillance. But when you look at the impact which one of these infectious disease outbreaks has on the economy of a country, it can be disastrous. Not only, if they manage to control it and it stays within their borders, or most of it stays within their borders, then that country can then end up being very much isolated by other countries as they reduce their trade contacts with them. They may inhibit the movement of people coming from those countries, and it's very damaging for future business to be done, even alongside all of the difficulties involved in trying to control the outbreak. And so you end up with this sort of so without quarantine, governments can't really combat an outbreak, so securitization of health happens, and you end up with some quite damaging and sensations attached to the outbreaks that take attention and resources away from other issues. It drives what is actually a fundamental human weakness to treat things as us and them when we're dealing with foreign nations. And so where we see the other country as being somehow responsible for the disease, rather than the disease being responsible for itself. And the way in which we treat that country is that like they're being at fault and that they're doing something wrong and that they're attacking our country in some way, shape or form. And so we take a very militarized and political approach to the infection control process in the disease, and this all tends to move the attention away from parts where it should be. And so it's very damaging for the economy. It can also a disease outbreak can also be used for political and economic gain between nations. A very good example of this is the Creutzfeldt-Jakob disease, the mad cow disease, which we had in the UK. And it's only in recent years that we've been able to start exporting our beef to large areas of Europe, which has had a standing ban on our beef long after we eliminated the disease from our country. And so as we still get occasional cases of this, the controls that we have in place mean that we've got some of the safest beef on the planet. But this some countries have still got restrictions on beef coming in from the UK, and the reasons for this are not just because of the CJD, the mad cow disease. It's also because this is very favourable for their own beef industry, and so it can be used in just, we see you going full circle here to where we were right at the beginning of this e-lesson, where international quarantine and public health restrictions carried out in the name of trying to prevent disease are being used instead to service free market service market-based interventions and political interventions, and so they're being used for alternative means. And so we need to, if we're going to deal with infectious disease, to cooperate globally and to treat these sorts of things in a very open and collaborative manner. The World Health Organization's Observatory for Global Disease being proactive in its approach rather than reactively waiting to be informed about outbreaks is one part of this process. However, there is much more that we need to do in order to be much more transparent if we have an outbreak in our own country and report it, even if it risks costly interventions for our economy. But at the moment, the fear of a backlash and issues for politically and for the economy act against the interest in public health in being transparent with data for outbreaks that have occurred within our own nation. And so we're seeing an environment globally where both are acting antagonistically, and there's no clear solution for these sorts of problems. So these are just some of the things that we have to live with in the global public health environment.